Hi folks, Craig here, use he, him pronouns, and I'm joining you from Wurundjeri country today to give you, very pleased to give you a CEO update from all of that's happening at VMIAC, and we've got quite a lot that's going on. So first I wanted to start with reconciliation. We've had a meeting of our Reconciliation Action Plan working group this week, and pretty excited about the progress that we're making there, and we'll continue to be working on that and updating you about that. It's a really important thing for us here at VMIAC that we get that done in place, and not just that it's done, but that we continue to be the best allies that we can be for the Indigenous community, including, of course, leading up to all of the discussions around the voice as well. It's going to be a tricky time, we know, for the Indigenous community. And also to recognise, of course, it was the anniversary of the apology made in Parliament some 15 years ago on the February 13th of this week. I wanted to talk to you about stigma and discrimination strategy submission that we've made as part of policy submissions just recently. So we hosted a consultation with the National Mental Health Commission in January around this stigma and discrimination strategy. Thanks to all of you who attended and provided your views to that. We also synthesised concerns that we had, and we provided a submission to the National Mental Health Commission on the draft strategy, and we made 6 recommendations. The link to the submission is below this video if you want to check that out, and also we'll provide some updates on our socials too. We have been very busy in this area, and there's also been a submission to the Disability Services Act where there was a response to a new act to replace the Disability Services Act of 1986. So thanks to our NDIS team and our DRC, Disability Royal Commission team, who led this work, also with great support from our policy and comms teams. So historically, people with psychosocial disability have been excluded from conversations about disability and disability service design, and this needs to change. So that's part of what we put forward in this submission. There's some important updates from our advocacy as well. First, thank you all who let us know your concerns about the system. And as some of you know, I think, the chair of our community management and myself have regular meetings with the Deputy Secretary of the Mental Health and Wellbeing Division, that's Catherine Wetton, and we also have regular meetings with the Minister for Mental Health, who is Gabrielle Williams. So we do have the opportunity there to take your issues to the highest level, where we discuss these, and where we push back quite hard around why these things are happening and what it means for consumers' lives when these type of things are happening that we know that you're not happy with. So speaking to those, I mean, first of all, I wanted to talk about leave in inpatient settings. We know how important leave is for people, so they can have a break from that really restrictive environment that is an inpatient unit, and also so you can get used to being out of the inpatient unit as you're sort of making that transition to being away from there completely. So we're a bit concerned that in some cases COVID restrictions have been, or very recently been, used as justification for people not to have leave. So we're working really hard on that, and wanting to make sure that we can find out as much as we can about that to try and improve that for people. If you've got any information about that, please do get in touch with us. The other one, of course, is that there is a Mental Health and Wellbeing Act that is coming into place on September 1st of this year. So there's a whole bunch of things that are enabled by that act, but the one I particularly wanted to talk about today was opt-out advocacy if you're being treated against your will. So currently, if you're being treated against your will, you can request an advocate, and you will get an advocate from IMA, Independent Mental Health Advocacy. What changes in the legislation on September 1st is that it's no longer an opt-in where you ask for an advocate. It's now an opt-out so you will automatically get an I'm an advocate, and you can opt out of that. So that's why it's called the opt-out. You don't have to have an advocate against your will, but you will automatically get one. And so we're looking forward to that happening as an important part of what happens in that act, which commences on September the 1st. More exciting news. There's a lot going on around a national consumer peak. So as I've said previously, on 30th of January, I went to Canberra for the Better Access Forum. So I went there with Ali Hodges from Lallan, the South Australia peak, and we represented the alliance of consumer peaks from the states and territories around Australia. So it's a really strong alliance, and we're working really well together. So what happened at that Better Access Forum, apart from the discussions around better access, which I've already talked about, was the announcement of Minister Butler, Federal Minister for Health, that there would be $7.5 million for the formation of a national consumer peak and a national carer peak. So I just wanted to be really clear that there's been so much work that's been done in the background around this for such a long time. And it seems that now is the time it's actually going to happen. So we have written correspondence to Minister Butler on behalf of the National Alliance, seeking a meeting with him to discuss how this is going to happen, what the governance is going to be of a national peak. So we'll update you as soon as we can on any news that we get there. And also, I've done a little piece that's featured in Croaky, and the links below about what we're looking for in terms of this national peak. So thanks to our policy and our comms team for helping me put that together. And you can see that below following the link. Another important update from me, this year is a year of the VMIAC conference. And we've had some correspondence from some of you, and thank you for that. Asking us about the conference. So it's on the plan for this year, and there's been a staff working group to kick that off. And also one of the first things we want to do is hear from you in our membership. So there's a meeting next Wednesday on the 22nd, and there's an Eventbrite link under this video where you can register to attend that meeting. And that meeting will be for us to hear from you about what you want from a conference. Conference is a time for people to come together, to talk about ideas, to meet people, new people, to catch up with people we haven't seen for a long time, and to think about what actions we want to take from here as we started kind of hear thought-provoking presentations. So questions that we want to ask you next Wednesday, if you can make it. Don't worry if you can't make it. We will have a survey for our members to tell us about what you want from the conference. But if you can make it next Wednesday, and some of these questions will be on the survey as well, of course. What do you think the theme of the conference should be? Some of you might remember the one at RMIT. It was listen up, listen louder. So we want to have a theme to try and focus the activity of the conference. What do you want to talk about at the conference? And how do you want to talk about it? Do you want big sessions with someone up the front? Do you want smaller sessions that are more workshop discussion like? Yeah, what's going to work for you? Who should we hear from? Are there particular people that we should invite? You know, we've had some pretty prominent consumer people before, like Indigo Deo, for example, and we've also had Matt Ball come in and talk about his sort of work outside of the mental health system. Any ideas that you have for speakers would be gratefully received. And so, yeah, it's an opportunity to talk, and what should we talk about? How should it happen? As I said, got any ideas about venue, what might work, or or aspects of the venue. Like I know sometimes some of them have access to an outside space, which is a nice sort of breakout area. And of course, we want to know about accessibility needs as well for people to access the conference. So as I said, if you can't attend on Wednesday, please do the survey and stay tuned, because we're really excited to bring a conference, and also we're looking at if it's going to work well to sort of combine the VMIAC Awards night as well as one night of the conference, but we're not completely sure on that yet. So I welcome your views on that too. All right, so fantastic. Looking forward to seeing many of you, hopefully, at the conference, and hearing from some of you who might want to present, talk about something. Yeah, please tell us next Wednesday anything that we should know about bringing a conference together for our consumer community in Victoria at this time when there's so much going on. All right, I'll see you there. So, folks, that's it for me from this update. Thank you very much for tuning in. Looking forward to hearing your feedback on some of the things I've talked about. Stay well. It's pretty warm the next few days, and look after yourself. I look forward to talking to you soon.